Hi, I'm Nicole Huck. This is Saskatchewan. Have you ever been scrolling social media and seen one of these ADHD ads?
ADHD test. If you put 5 fingers down, you have ADHD. Put a finger down if you leave things half open, like cabinets, drawers, or doors. Put a finger down if you've ever focused on something for hours and don't notice the time passing by. Put a finger down if you often forget things. Put a finger down if sometimes you just don't eat. Put a finger down if you've lost something important multiple times.
So, taking a test on TikTok isn't the same as going to a doctor and getting a diagnosis, but it sure does have a lot more people questioning whether their short attention spans or inability to finish a project can just be chalked up to ADHD. I recently threw up a post on my Facebook page asking if any of my friends had recently been diagnosed with ADHD, and I was shocked by the response. So why does it feel like so many people in Saskatchewan have ADHD? Dr. Stefan Brennan works at an outpatient psychiatry clinic in Saskatoon. He diagnoses adults with ADHD every week. Dr. Brennan, welcome to the podcast.
Thank you very much. Thank you for having me in studios today for a discussion.
So obviously not everyone has ADHD, but it sometimes feels like that in recent years. Do we have more cases of ADHD or not?
I think there's probably a multi-layered answer to that question. I would certainly say if you look at the data that we've been able to gather, the prevalence of ADHD is going up. So it is being diagnosed more. I think people who have worked with ADHD or neurodevelopmental disorders for some time would say that we are probably diagnosing ADHD more and hopefully diagnosing it more effectively. So whereas there may have been many more undiagnosed patients in the past, we perhaps are diagnosing more, particularly adults with ADHD now.
Do you have a sense of just how many, what's the percentage of the population, anything like that?
Yeah, and we'll probably always look at sort of United States data or Canadian data if we can. You'll often hear sort of like a prevalence rate of between 4 and 5% in the population, though that number does appear to be increasing. And as far as sort of the best Saskatchewan data I could find from the Student Wellness Center at the University of Saskatchewan, they reported that 7.3% of their university students, which is a common population for ADHD, have been diagnosed with ADHD.
Wow. So I want to talk about social media. I feel like they're hand in hand these days. So it's very common to see people on TikTok or Instagram Reels talking about their own ADHD and their own ADHD journeys. So how do you think that this is playing into people questioning whether they themselves have ADHD?
Yeah, I think, lived experience in mental health is increasingly something we recognize as important, and that's not just ADHD, that's in, mood disorder and schizophrenia, psychosis, and addictions, sort of all areas of mental health. I think certainly social media, there has been a lot more attention paid to ADHD, and so when they track Google searches, they look at people who are trying to look up this. Probably social media is amplifying the message a bit. And I would say that's not always necessarily a bad thing because, of course, as I probably indicated before, previously, like when I started working with adult ADHD, it was very, very underdiagnosed, and people often didn't know where to go or how to start looking at attentional and concentration and focus and hyperactivity issues because they were an adult. So some of this has been positive in that it's directed people towards seeking care. Of course, you have to look at the source where it's coming from, though. Like how reliable is this information, and that's where the challenge sometimes is.
Yeah, when you heard that clip earlier about, put your finger down if you have misplaced something, and what are your thoughts as a doctor, as someone who knows what's going on? What were your thoughts listening to that?
Well, I actually hear clips like that all the time as I have a 9-year-old son, and
Okay.
he's endlessly finding things on YouTube, TikTok, and I'm used to hearing that voice in the background, uh, asking questions. Yeah, so again, I would not say that's like a reliable or valid screening tool. I would sort of kind of question about, what is the source here and what are they using for that information. But I would certainly say that increasingly patients that we see that are being referred to us are, kind of coming in, for example, having done something like an ASRS, like an adult screening tool, and saying, I think a lot of these symptoms apply to me, and I think this is something that I need to investigate further. But again, TikToks like that, maybe not the most reliable source of information when you're going to see your physician or healthcare practitioner.
Okay. So Sierra Giesbrecht was recently diagnosed with ADHD. She's 32. She lives in Saskatchewan, where she's a mom and a content creator and a makeup artist. And like many people I know, she started thinking about it when she was getting her daughter diagnosed for ADHD.
ADHD in women or girls oftentimes presents a lot differently than we see in boys or males. So a lot of the times we are looked at as maybe having anxiety, bipolar, those sorts of things. I was diagnosed with anxiety about 6 years ago when my daughter was 1 year old and have been taking medication for that. But I had also brought up some other points there about, compulsive spending or really I don't want to say manic, but extreme highs, or also lows of not being able to do things, but it wasn't necessarily depression. So I knew something was there, but they didn't diagnose me with anything further. But like I said, after my daughter was diagnosed a couple of years ago, going into grade 1, I really started to kind of understand and look at what some of these signs were and what her body was demonstrating. And I saw a lot of similarities between her and I. And some of those were, compulsive behavior. Sometimes that meant outbursts of anger. Sometimes that meant being hands-on. For me, growing into adulthood, a lot of the times it was compulsive spending and then having extreme remorse or guilt afterwards and going to return something. Having a hard time breaking things down into smaller pieces. I would have tons of amazing ideas and goals, but it was really hard for me to break those down into bite-sized pieces and to get things started to actually put things into motion. And I was also really noticing that I was very overstimulated at home, especially as I became a parent. I mean, little kids are very, demanding. They also make a lot of different noises. There's a lot of things going on. And I often felt like I was overstimulated or becoming angry from just random noises.
Okay, so Sierra brought up a lot of things there, and parents might be thinking, though, that's me. I'm overstimulated and angry, or I have trouble putting my ideas in action, or I'm bad with money. Do I have ADHD? So Dr. Brennan, what are some of the most common symptoms for adults with ADHD?
Yeah, I think that was excellent because that's really not an uncommon story we hear to begin with. Parents with children who are starting to see a pediatrician, see a family physician, nurse practitioner, and they really recognize that a lot of the same symptoms resonate with them, or maybe did in their own childhood, their school years, their university years, or starting with work. And so, I mean, a lot of the symptoms that we do see that we would hear about would be difficulties with attention and maintaining focus, difficulties with being, very over-focused or hyper-focused when something really has a high level of interest, real difficulties with switching focus, like going from one task to another, completing a task and then being able to move on to something else. And then the sort of that distractibility piece, like, you need to do something, but there's something else that's much more interesting or exciting. So it keeps drawing your attention. And that probably feeds in perfectly to like the different types of ADHD that we see, in children and young adults, and then in adult patients that I would see, that you can see the sort of classic hyperactive impulsive ADHD. You can see a lot of the core inattentive symptoms, which is, difficulty with attending, maintaining focus, are really what we see a lot of, especially in adults, is what we call combined ADHD. And that just describes a symptom cluster of patients that have real problems with attention and focus, but then as an adult also have some of these impulsivity symptoms still. And that's the reality for a lot of patients.
Does it often run in families?
Oh, certainly. Yeah, there's a strong genetic component to it. Depends on the study you look at, that, 5 times more likely in family members, to run through. There probably is some genetic link with, we believe, some of our dopamine genes. And then I would like to say, too, like when someone's talking about a history of, I was diagnosed with anxiety, or I was diagnosed with depression, or I was diagnosed with a sleep disorder or another learning disorder, probably 80 to 85% of ADHD patients do have another mental health diagnosis. And that can be things like mood, things like anxiety, things like bipolar. Unfortunately, greater risk for diagnosis of substance use disorder. And again, probably some of that is purely biological as well.
So the other thing that she mentioned was, how ADHD showed up in women and girls. What are your thoughts on that? Does ADHD look different in women than it does in men?
Certainly, yeah. And that can be part of the challenge with diagnosis. If you look at most of the rates, it's probably, the rates are 2 times higher for males versus females. Basically that,
there's twice as many men diagnosed with ADHD?
Yeah. And some of that might just be, again, some of the gender bias that we see. It also may be just how people present. Like if you present with more of a hyperactive, impulsive presentation, which, let's say, younger males, boys, teenagers might, that's a lot more visible and easier to diagnose. With female patients, of course, they can have a lot of hyperactivity, impulsivity, but there also can be a lot more inattention. And that can be harder to note because, people have, compensatory strategies. People have, good parents and good supports, excellent teachers. But sometimes we really see it's at those life transitions that people start to struggle. And that can be, for example, when they leave high school and they move away to go to school or college, or again, they move out of home, they're starting to work. And then a lot of that, if you want to call it lattice or support network that they had, just isn't there anymore. And then they really start to struggle. And that would certainly probably be the picture you can sometimes see with younger female patients.
Yeah, and I mean, Sierra was talking about, also a diagnosis of depression or anxiety. Mm-hmm. Is that often the case in women where you're getting multiple diagnoses at the same time, or that they're going hand in hand?
Yeah, and that's often the case for male patients too.
Okay.
I mean, if you want the thumbnail sketch is that ADHD is an illness of comorbidities. I really, seeing adult patients, I'll be honest, it's quite rare that they just have a pure ADHD diagnosis. They've often been assessed for a lot of different things. As I said, depression, bipolar, anxiety. They may have sleep issues. They may unfortunately have had some substance use issues which have been identified. They may have other learning disabilities that were diagnosed when they were younger, for example. The pure ADHD patient, to be honest, is actually quite rare. It's very common that they have other comorbidities. And sometimes it's a big challenge for us is what do you treat first? And of course, often you treat the most disabling thing first, like if they have severe depression or anxiety. But by the time they're seeing a specialist like myself, often they have been, diagnosed with a number of other things, have been treated for it, medications, counseling, groups, self-help approaches. And sometimes they're quite frustrated, of course, because, the ADHD is the part of the picture that just hasn't really been identified or treated.
Okay, so you have all these people who are questioning whether they have ADHD. They're seeing, it being talked about a lot more frequently. Maybe their kids been diagnosed. How do you actually go about getting a diagnosis?
Yeah, and again, I will say there's probably no real magic to it because it's a clinical diagnosis, as much of mental health is. You will have self-identified patients. I mean, obviously, I get referrals, being a specialist, where they say, I really think this person has some attentional issues, and we've talked about it, or we've got them to do this self-test or rating scales, but can you give us a bit more of an opinion on it? So what we do is we try to use what we call like our DSM-5 criteria. We try to take very good neurodevelopmental histories. So we ask them about what do they know about their childhood, their school. Often we're asking about symptoms being present when they were much younger, and then sort of transitions in life, sort of things like high school, when they were transitioning to secondary education or post-secondary education or work. The numbers you'll see, it used to be that we seem to think that ADHD kind of went away when people grew up. They matured out of it. But realistically, about 60 to 65% of patients will continue to have significant ADHD symptoms. So it doesn't really go away. It's just the symptoms can look a bit different in adulthood. So we'll explore that part of the history as well, which often can be things like relationship history, work history, accidents, driving infractions, sort of the whole way that some of these symptoms can affect their adult life. And then we will do as many rating scales as we can. I mentioned things like the ASRS. There are lots of good scales, the Barkley, the Weiss, some of these functional impairment scales. In a perfect world, you can get what's called like a psychoeducational or a neuropsychological assessment. There are groups that will do that, so that's sort of like a battery of tests.
And how easy is that to access? Like, is there a big gap in this province between people who have private coverage and people who don't in terms of being able to access assessments for ADHD?
Yeah, actually, the quicker answer is there's a big gap everywhere.
Okay.
Because, we have like excellent resources like LDAS, the Learning Disabilities Association of Saskatchewan, that do these assessments, do ADHD coaching. But yeah, there are limits to how many people can access that. If you're in an educational institution, you may have better access because they'll have some counselors or people that can do some of this work with you. But if you're out in the real world and you're an adult and you're working or being a parent, doing whatever else with your life, it can be hard to access. And certainly we've seen kind of a rise in these private assessments where people will, contact a private agency and sort of pay to do an ADHD assessment.
How much might that cost?
It depends on how much you're willing to pay.
Okay.
It can be as little as maybe like, let's say $300 to $500 to do like mostly an online one with someone who will get you to do this sort of battery of tests, and then we'll do sort of a structured interview with you and provide you with a report. But if you're going to like a top-end private clinic, it's probably something like maybe about $2,000 to $3,000 to get this done. Yeah, so that is a barrier, certainly. And I'd also like to point out, too, that I'm a psychiatrist. There aren't a lot of us. We're actually not the ones that do most of the diagnosing of ADHD. It's often our excellent primary care colleagues, so family physicians, pediatricians, probably increasingly people like nurse practitioners as well. It's actually a lot of primary care people that have some training, some experience now, and they're often making the diagnosis and then following up with these patients and providing treatment.
Okay, so let's talk about treatment. So once people are diagnosed, they have options. So they could start on drugs, or they could probably work on strategies with ADHD. But how many people choose to go on drugs?
Yeah, and that's a good question. I mean, I think probably, again, you'll see probably about at least 60 to 65% of people with, let's say, more moderate to severe ADHD will be on some type of medication. And often the first line evidence-based treatment will be like a psychostimulant or a stimulant medication. So,
what is that actually doing to your brain?
Yeah, so it's interesting if you read, because ADHD is not new. We've talked about this type of stuff for over 200 years. We started using amphetamines to treat these symptoms probably in the 1930s with hyperactive young boys, essentially. We used to call it a paradoxical reaction, meaning like, well, we don't really know why. We're giving stimulants to people that are already hyperactive, but it works better, so that's paradoxical. That's not what we think is true, to be honest. We believe it's probably A couple of neurotransmitters, primarily we think dopamine, also probably something called norepinephrine. We think a lot of it has to do with what's called your frontal lobe or your prefrontal cortex, so the very anterior part of your brain, which has a lot to do with what we call executive function, so sort of like planning, sequencing, and working memory. So we think that these medications are probably working on these kind of hypoactive areas of parts of your brain and helping you to regulate a bit better. However, I'll be honest, I'm not giving you the definitive
Sure.
science of this. It's still something that we're actively researching for targets.
And I want to talk about the difference that drugs can make for people. So Sierra, the mom from Saskatchewan, decided to go with medication.
I've been on Concerta consistently for about the past month, and I have seen some changes. Definitely a little bit more focus for me and being able to handle those overstimulation pieces a little bit more. But it also gave me some validation for how I was feeling when I was growing up, and why I was the way I was. Because oftentimes kids with ADHD are just labeled as bad, troublemakers. They're not successful in school. They're mean or angry, but there's so much more to us, and our brains just work so much differently. So it really gave me that validation that I finally kind of understand my brain a little bit more now.
So she went on to say that the diagnosis for her daughter and her gave her the ability to be a little bit more empathetic with her daughter and maybe even cut herself some slack. So I can see the benefit of a diagnosis in her case, but the drugs are tricky. So since Sierra recorded that, she's since changed drugs. The first drug she switched to gave her major depression. She switched again. I mean, it's not just like a one-stop shop for people. I feel like it's a bit of a journey. What kind of side effects might go along with ADHD drugs?
Yeah, and so again to give you a number, probably we hope that about 80 or 85% of ADHD patients will see some benefit with a frontline medication like a psychostimulant. We'll see clinical and valid improvement in their lives. How do we treat with these medications? Start low and go slow. I've certainly found this in my clinical experience. If you overshoot, if you start too high or increase too quickly, you can give people side effects which unfortunately are uncomfortable, sometimes make them lose confidence that these are, the right medications or a good choice for them. So we spend a lot of time on psychoeducation, and maybe I'm lucky, I'm a specialist, I have time to, talk longer to patients than, 7 to 10 minutes. But I talk to them about things like appetite suppression, which can certainly happen at the start. So about planning eating. I talk to them about the importance of sleep and sleep hygiene. I talk to them about the possibility of things like headaches or muscle tension, about the possibility of noticing some increased heart rate when they're first getting used to the medication, and that these are all normal things. But that if we, again, sort of agree on a plan, start low, and kind of slowly titrate up to try to get to an effective dose, we're likely to have greater success. Again, patients, it's probably genetics. It would be great to say that everybody responds to the same medications, but they don't. Maybe about 50% of patients will do with either what we call methylphenidate, so a Ritalin-type medication. Will also do well with like a dextroamphetamine or dextrin-type medications, but some are really selective for one or the other, and we end up having to do switches.
So, I mean, I want to take the big picture here. So I think there's probably some people who are thinking, now what? There's so many people now who have ADHD. Does it lose its meaning when everybody in the workplace has ADHD? So, how does this affect? How do you see this affecting society, like our workplaces and our relationships, everything?
Yeah, that's an excellent question. I'll be honest, as being a physician, the practical side I often see of it is something called accommodations, because again, I will see a lot of younger patients, a lot of university students, or again, young people at work, and we actually do try to advocate for structured accommodations so that despite being medicated or being given medications to improve their symptoms, they will do better with like different behavioral strategies that allow them to break tasks down, to take breaks, to structure their time a bit differently, to recognize some of the challenges they have. How does that translate into the real world in the workplace? It's tricky. Not everyone wants to identify as having like an illness or a disability, but sometimes the discussions we have is that you are really struggling, and I mean it's probably affecting your work life, your family life, your home life, and having discussions about this is an illness that I have, I'm being treated for it, I'm trying to do follow-up, I'm trying to do behavioral interventions, then you can actually try to work, for example, work with an employer or try to get some better outcomes.
Or in the case of the U of S students, I'm sure there's accommodations in class and whatnot.
Yeah, they have an entire division for it, of course, access and equity, because it is just so common.
Yeah.
And yeah, we talk to them. We sort of say, okay, is it about studying? Is it about his exams? Is it about getting papers done? And again, some people will say that's controversial. We shouldn't be providing these accommodations to people. But again, one of the things we point out is that ADHD has nothing to do with intelligence. Like IQ or intelligence is completely independent of the diagnosis. And sometimes, when treated and with some accommodations in place, then of course your natural abilities, you can achieve the level you should.
Dr. Brennan, thank you.
Thank you very much. I would just like to kind of quickly point out, I know it can be hard to access these services, but again, primary care is an excellent resource. There are some good online resources. I'll mention things like CADIC and CADRA as fancy acronyms, but there are good online resources that people can access to maybe help them start to get beyond TikToks and seek some appropriate help.
I'm just curious. What's the oldest person who you've diagnosed? Is there a value in a diagnosis if you've lived for 80 years with this?
I've diagnosed somebody in their late 70s, and yes, they're on their treatment on medication in their 80s, and they're very happy that they're being treated. I mean, they knew they had challenges their whole life. Their family knew, their kids knew, their grandkids knew, and not everyone will choose to go on medications at that stage in their life. But if it really is so impairing, it can still be very valuable to provide treatment.
And you talked about 200 years of us knowing about this. Are there some high profile people in history that you believe had ADHD?
Yeah, well, I should have thought of that about a bit more before I sat down here, because you will certainly see some professional athletes that have been diagnosed with it, and then end up having difficulty with getting a positive stimulant test. And then of course, they revealed that they have ADHD, and that's why they were taking prescribed stimulant medication. But it's very tricky because of the performance enhancement part of it. So that would be sort of an example you kind of commonly see play out in public is, about high performance athletes with ADHD.
Interesting. Well, thank you very much.
Okay.